Okay, we're just getting started. This is the medial compartment. This is where we expected to find a little bit of arthritis. The meniscal tear we've been working on right here. You still got some tearing that extends around posteriorly. And as you can see, it extends all the way around to the posterior horn of this medial meniscus. We're doing as much as we can with our shaver. And then in a minute here, we will likely use a pair of scissors to help. You can see where you've lost some cartilage here on the tibial plateau. You've got an area of full thickness cartilage loss there. And on the femoral condyle up above, you've got some similar areas that are at least thin, if not completely missing. Yeah, it looks like it's just thin. I don't see any full thickness areas really yet. Okay, pause. Let me see a scissor. Okay, so we're done in the medial compartment. Obviously, there's arthritic change that we're not going to address today. We're going to do our orthobiologic injection with the PRP just to help longer term. But at least the offending meniscal tear has been taken care of. We're now going to look in the middle part of the knee, and there's a nice, pretty anterior cruciate ligament. You can see that there. Looks reasonable. It might be, at least it looks reasonable at the tibial side, but we're about to see a whole lot of arthritis on the lateral side, I can tell. So we'll go off on the video for a minute. Okay, now we're looking in the lateral compartment, and this is not great news. You've got a lot of degenerative tearing in this lateral meniscus, which is one thing, but even beyond that, as we start to get a better look, we can see you've got the central area where you've lost all the cartilage down below. Certainly a source of some symptoms, I would guess. And then up above, you've got this central area in the femoral condyle that's missing cartilage too. And that makes things a little bit dicey as far as treating your symptoms without having to do something more aggressive than just what we're doing today. But we will use all our tricks before we get to a knee replacement, like we talked about. So, do you have a light wave or no? Okay, that's fine. Okay, so we'll keep working here, but I just wanted to show you the extent of the damage, the arthritic damage in this compartment. It's way more advanced than the medial side. The medial side was already mid-grade. This is really advanced because we're down to bone-on-bone changes here. Okay.